Thank you, Pam. And thank all of you for withholding your desire for lunch. As Dr. Rich said yesterday, one of the great things about a conference like this is not only turning around and meeting colleagues and folks we don't know, and over dinner and over drinks and over video games, we get to talk research and get excited about things. But one of the best things, I think, is the session we're actually going to have now, and it's outside now. It's called Poster Sessions. And it allows all of us to interact with some of our grad students, young scholars, established scholars, and some very, very fascinating research. Our committee, who we'll keep secret, looked at lots of poster submissions, and we chose ones which we think really highlight the issues in this particular conference. And during lunch and after lunch, please, please interact with all of these incredible individuals. I think all of us will learn a lot. And one of the things we asked 5 of them to do is to present something called a flash talk. Now, some colleagues have asked me, Ed, what's a flash talk? And I said, no, it is not I introduce them. They come up and flash and talk. That isn't what it is. A flash talk in a digital conference is pretty much the Twitter of a presentation. We've asked each of them in 3 minutes, and if you think there was angst amongst our colleagues talking in 7 minutes, we've asked them in 3 minutes to whet your appetite, to raise the big question, to talk about what's exciting about their research, and also the research that other folks are doing. And that is, I think, what makes Flash Talks very, very interesting. I'm going to introduce every one of them. Are they here? They should be able to just come up to the stage. Are we all here? Good. I'm going to quickly give their names and their affiliation, and then I'm going to go down, sit with Pam, and act as the gonger for 3 minutes. And I think you'll find them fascinating. We asked them again to whet our appetite, and when the flash talks are over, we will have lunch. But once again, keep in mind, there are great posters out there. Let's interact with our colleagues. I think all of us will find it quite fascinating. So let me quickly mention their names, their affiliation, and then I will sit, and I apologize if I get the pronunciations wrong. Koeun Choi from University of Wisconsin-Madison. Go Badgers. Kevin Collier from Ohio State University. Go Badgers. Lauren Hale from Stony Brook. Marisa Putnam from Georgetown University, and Jenny Radesky from Boston University School of Medicine. So the slides are up. Each of them will come up for 3 minutes. I'll give a gong if I can. And thank you all for doing this, by the way. Thank you.
Hello everyone, my name is Koeun Choi, and I'm a graduate student working with Dr. Hale Courian at the University of Wisconsin-Madison. Today I'm going to talk about children's learning from screen, especially their transfer of learning from screen to a real-life event. To test their learning, we use a hide-and-seek game. So before we actually test their learning, we went over a training to make sure they understand the link between the screen and the blackboard. And after the training, we present a hiding event on a screen, and we ask the child to find the hidden object on the blackboard. Although there was very little perceptual difference between the screen and the blackboard, toddlers had a hard time finding the hidden object in this task. So we were wondering, what if we reduce the perceptual difference or even eliminate the perceptual difference by replacing the felt board with another touch screen? Did this condition help children transfer better? So to answer this question, we designed 2 experimental conditions. In the first condition, we asked children to transfer between screen and the felt board. In the second experimental condition, we asked children to transfer between screen and to another screen. Did the within context transfer, screen to screen transfer condition help children's transfer? The answer is yes, but not always. So there were 4 trials in total, and children got 4 chances to find the hidden object. And if you look at the first 2 trials, the earlier trials, children in within context transfer condition, screen to screen transfer, they performed better than their peers in other condition. However, if we look at their learning over time, their performance tends to drop down. So compared to the other condition, the effect was actually reversed. So based on this finding, we concluded that children's learning, even the transfer between screen to screen, is still difficult, especially when we look at their learning over time. I'll be presenting this poster, so feel free to stop by with to share any questions or comments. Thank you.
Thank you for that. My name is Kevin Collier. I work at the Ohio State University with Brad Bushman. But my presentation today is more on work that I've done at Brigham Young University. It's on parental mediation of media. For those of you that are unaware of what that is, we've talked today and yesterday during several discussions about how we can help mitigate the negative effects of media consumption in our children and in people in general. And so one of those that I feel very passionate about are parents. Parents are around their children most often, more so than other cases such as educators and hopefully. Anyway, so there are 3 types of common parental mediation. One is restrictive mediation, where parents limit the content or the amount of time or the type of medium that a child is using. Active mediation, where a parent is trying to instill a critical mind in their children to help them more have a critical mind in their consumption of media. And then co-viewing or co-use, where a parent uses a medium with the child. And the whole idea is to help prevent the negative effects and promote more positive effects from that media consumption. And with my poster, we did a meta-analysis on the effectiveness of these types of parental mediation with 4 most common outcomes, mainly aggression, substance use, sexual outcomes, and aggression. And the literature in and of itself we found is very mixed in whether parental mediation has a positive influence or a negative influence or no effect. And through our meta-analysis, we did find that there are varying degrees of effectiveness, but for the most part, the literature is very mixed. And we have several moderators that we looked at. Age, for example, could be a potential moderator, whereas younger children are more accepting of restrictions. Later in adolescence, the adolescents want their autonomy, and so restrictions may not work with that. And so we use that as a moderator, the different types of mediums that were used, as well as who was reporting both the outcome variables and the types of parental mediation. As well as do these types of parental mediation have more influence towards attitudes or towards behaviors. And so the takeaway that I'd like you all to take is that parental mediation, we did find that it does matter. It did have a low effect size, but it does have a significant effect size. And so we're hoping to come up with better measures of parental mediation, because there's a lot underneath that term that we're not quite getting at. And so if any of you are interested in that, please talk to me afterwards.
Okay. Hello. My research investigates the social patterning of sleep and its consequences for health and health disparities. Sleep is essential for learning and memory consolidation, for physical health, including obesity, as well as psychological well-being. And if some segments of the population are not getting enough sleep, that could be contributing to why we see divergent population outcomes. In my prior research, I've studied sleep patterns of ethnic minorities, of low education populations, and those that live in inner city neighborhoods, and find that they are getting less sleep. And in recent years, I've turned my attention to adolescents. And sure enough, I have found that the very most vulnerable population when it comes to not getting enough sleep are our teenagers. Depending on which cut point you use as the recommended sleep duration, between 50 and 90% of our nation's teens are not getting sufficient sleep on a regular basis. So there are three basic mechanisms through which screen time can affect sleep. The first is time displacement. If you are looking at a screen, especially at nighttime, you are not doing a healthful activity, especially something as all-consuming as sleep. The second is psychological stimulation due to the social, emotional, and sometimes violent content of screen-based activities. And of course, there's a third effect of light, which has both alerting and circadian effects on the body, making it more difficult to fall asleep. My grad student at Stanford, Koeun, and I looked at 67 studies published between 1999 and 2014 from all around the world, but you can see the green areas represent where more are represented. And we found that 90% of the studies found a significant adverse association between screen time and sleep. There was some variation depending on type of device that was studied. One of those categories is unspecified screen time. But you can see for all of the types of devices, an adverse association with screen time was found. Now, of course, there are a lot of limitations to this research, and that was why I conducted the lit review to see what's lacking. Most of these studies do not show causation. They're simply associational, one point in time, one measurement of sleep and screen per person. Most of the data are self-reported data, and with measurement error, that tends to attenuate the effect sizes, thus underestimating the true effect sizes of the association. And finally, many of the aspects of screen time that we've discussed in the last few days have not been considered by the sleep community, such as multitasking, the interactivity of screen times. Although I will note that the interactive screen studies are more likely to be associated with sleep duration than screen time, TV, more passive ways. And of course, content of media is essential in understanding this. I'm fortunate to currently be involved in a study where we're collecting sleep and screen time activity using actigraphs on 1,000 teenagers from across the country. So we hope to address some of these limitations. And if you want to talk more to me about this, I'll be at my poster, or we can talk over lunch. Thanks a lot.
Hi, I'm Marisa Putnam, and I'm from the Children's Digital Media Center at Georgetown University. And today I'll be talking to you about a project that explored whether a popular media character embedded in an iPad app could influence the snack selection and consumption patterns of young children. There's an obesity epidemic, a childhood obesity epidemic in America today. Over 16% of kids are obese, and an additional 15 are at risk for obesity. So one way to help kids combat this epidemic is to help them make better food choices. And one vehicle for this might be through media. Children are consuming media via new technologies more than ever. Between 2011 and 2013, the time a child spent per day with their tablet tripled. So this could be a really powerful tool in reducing obesity. One kind of media that kids are consuming on their tablets is Advergames. And Advergames are video games that market a product. Often this product could be an unhealthy food, which might be contributing to poor food choices for children. Another thing that might be contributing to poor food choices by children is when a popular media character is used to brand unhealthy products. So media characters are everywhere in children's lives, from the clothing they wear, to the games they play, to the TV shows they watch. But they're also on the packaging of the food they eat. As you can see here, Shrek, Scooby-Doo, and SpongeBob are used to market unhealthy products. So our current study is investigating whether children's snack choices can be improved if Dora the Explorer, a popular media character, is used to brand healthier items in an Advergame. And we are also exploring whether children's conscious recall of Dora in the game could be helping kids to make these choices. So thank you for letting me market my poster about children's marketing to you. And I hope you stop by my poster to learn about how we tested these questions and the promising results that we found.
So I'm Jenny Radesky. I'm a developmental behavioral pediatrician at BU and Boston Medical Center, and I'm going to be transitioning to University of Michigan in the next couple months. Go Wolverines. Go Blue, sorry, I'm going to have to learn. So as a pediatrician, I'm really interested in translating all of the research on digital media into really practical, relevant guidance for parents. And the main way that we deliver this guidance to parents through pediatric providers is through Bright Futures. This is the main preventive care guidelines that are issued to residents in training as well as pediatric providers. And I got funding from the Bright Futures Young Investigator Award to examine their third edition. They were in the process of revising to the fourth edition to try and see where the gaps were around where they were providing guidance around mobile and interactive media use. Because the third edition had nothing about that sort of media use by young children or their parents. And I think a lot of the research on traditional media like TV and video games can be applied to this new generation of technologies. But I really came into this with the hypothesis that mobile technologies have a lot of differences that warrant additional study, that they are multimodal. You can use them for so many different things. They're portable, they're instantly accessible, they're interactive in different ways that either suck our attention or help spread it around. So they have different implications for family dynamics and mediation practices. But we also know that really, as we're trying to create pediatric guidelines, we're barely keeping up with the rapid evolution of technologies, so our data is currently limited. I really wanted to therefore explore, what do parents think of this? What are their perspectives about these changes in their lives and their children's use? So my other area of study involves what a lot of people have been mentioning here at this conference, is that parent technology use. I've done a couple studies in lab-based and naturalistic settings showing that parent technology use, especially when parents are really, really absorbed in their devices, can distract from parent-child interactions. And parent media use is also really important because of the modeling and just the general contextual influence in the home that predicts higher child media use. So my aim in this small study was really very hypothesis generating, trying to get a new framework for how we can talk to families about this. So I wanted to explore parent conceptualizations in a very open-ended way about mobile and interactive media and family dynamics. And I therefore conducted 35 in-depth, semi-structured interviews. 35 seems like a small amount, but it's pretty standard for a qualitative study like this, because each interview was about 1.5 hours to 2 hours. These are all English-speaking caregivers, so that does limit generalization, but they were all caregivers of young kids. We transcribed all the interviews, and then we did, myself and 3 other colleagues did iterative, qualitative, thematic analysis of all the transcripts, trying to get, using grounded theory methods, we were trying to see what's really arising from all of these parents' perspectives and what kind of themes can we draw from that. And we tried to do really purposive sampling because we wanted to get a really diverse range of viewpoints. So we recruited from my urban safety net hospital, but we also went to some suburban parent organizations, an academic institution, a local tech company, because I wanted to see how this varied amongst different parents. So my thematic model that came out of this is that there was just constant discussion of tension, that parents came to these focus groups sometimes saying, thanks for holding this support group. That it was like they loved hearing that other parents were struggling with this, that there was this constant exchange of the pros and cons, the risks and benefits. And so what my team analyzing these transcripts came up with was these kind of transactional tensions between the parent and their digital technology, the child and their digital technology, as well as the way digital technology affects the dyadic interaction between the parent and the child. And they just had really fascinating things to say. My poster outside really only captures the views about the child technology use, these tensions between wanting to keep up with their wanting to be a good parent and provide all these new technologies that are marketed as highly educational, versus a lot of parents' concerns, how is this affecting my child's imagination, creativity, social skills, critical thinking? A lot of tensions between, this is the most effective calming tool I've ever had for my child, versus knowing that those moments of connection between parents when they unplug is also a really good tool for teaching their child some social and emotional skills. When it came to parent technology use, a lot of discussion of the way that mobile technologies kind of help work seep into our home lives, both in good and bad ways, and feeling these pressure to keep up and stay relevant in their jobs. A lot of discussion about the kind of excitement versus exhaustion of keeping up with social demands, and this feeling of like, why, almost an intrusive feeling of like, why do so many people have access to me, and why do I have to respond right away? And also this tension between, I use this as a stress reliever, but it is now, all my stress is in my lap every moment, that now kind of can intrude upon my, what Don Schifrin calls the sacred times with my kids. And these all kind of came together in themes that we heard over and over again about the intrusion into family time, how difficult it is to then toggle or multitask between your work brain and your child brain, or your to-do list on your tech device and your being emotionally available for the child. And that I'm really interested in knowing, how is mediation different? How are these kind of monitoring practices different when you have these devices that are handheld, have limitless loops of Netflix videos on them, and how does it differ by the child's characteristics too? There's been a lot of talk here about the differential susceptibility, and I think that was something that came up quite a bit also. So I'd love to talk with people afterwards about what the implications for care is also.